Why is it that when something goes wrong with your body, especially if you have an injury, doctors want to fix the thing that broke, but nobody's really looking at the bigger picture? Doctors are usually not asking, okay, but what was happening in your life when this started? How were you sleeping? How were you feeling? They're looking at the scans, they're looking at the MRI results, and somehow the whole person attached to the body is not part of the conversation. I learned this the hard way, and I want to tell you about it. You're listening to The Bold Beginner, a space for multifaceted women where we explore how to feel at ease in your body when you're being seen. If something here speaks to you, consider subscribing or leaving a review or a comment. It genuinely supports the growth of this space. A while back, a couple of years ago, I got a severe hernia. It was not a just take it easy for a couple of weeks hernia. It was more a you might need surgery hernia. And I was in my early 30s, by the way, which I don't know, somehow made me feel like it was not supposed to happen yet. I'm more supposed to be in the prime of my life. I've read ever since that it's actually quite common to have a hernia in your early 30s, but probably not that severe. And it just so happened that I was already going through a really, really hard time, deep in a burnout where I just barely could get out of bed in the morning. And on top of that, it kind of goes with it, I was dealing with depression. So I was mentally in the worst place I'd been in, probably ever, and somehow my body was in a crisis too, which, you guessed it, was definitely connected. And what happened next is what I want to talk about. Because obviously I got into the medical system, right? And I started getting passed around doctor to doctor, specialist to specialist, and each one had their piece of the puzzle. But it really felt like nobody had the whole picture. And not only they didn't have it, but they didn't really ask for it. Nobody just sat down and asked me, so what's going on with you? Not just your spine, what's going on with you in your life? And before going any further, I want to make a disclaimer that I'm obviously not against conventional medicine. I am not, doubting the progress of science, any of that, quite the opposite. But that being said, the overall energy felt very much like it was, let's fix the symptoms, let's manage the pain, and let's get you functional. So I definitely did feel quite a lot of pressure towards infiltrations, injections to manage the pain. And I kept saying, I don't want this. I don't care about the symptoms. I want to understand why this happened. And I want to fix the actual problem, the root cause. But when I did say that, when I did repeat that, actually, many times, I could tell that it was a weird thing to say. It wasn't how the conversations were supposed to go. Apparently, you are just meant to be grateful and to be like, yes, fix my pain, thank you, and that's about it. And you're not supposed to ask why. And I think the most telling part is that the spine doctor said something to me that I will never forget, because I was asking him if I would be back to being able to serve and to dance after that said surgery. And he answered me by saying, well, let's focus first on getting you back to being productive. And I'm not going to lie, I was in a bit of a shock after he said that because, like I said, I was in a depression, I was going through a burnout, and I was in my early 30s. And my actual goal, the thing that I was looking forward to and that would keep me up at night, it was, will I ever dance again? Will I ever surf again? Will I ever be able to walk again for more than 10 minutes without being exhausted and in pain? Will I feel alive again, or is this the situation that I'm going to be in for the rest of my life? And this doctor, who was genuinely trying to help me, I'm not, saying there was any mean intention behind it. His frame of reference for my recovery was, can she sit at a desk for 8 hours? And I don't blame him. I really don't, honestly, because I think that's the frame of reference the whole system gives him. That's what better means in that world. It means functional, it means productive, it means back to work. But for me, on my end, back to work was not even in my top 5 priorities. What I wanted was to feel my body again. I wanted to move without fear, and I wanted to come back to life, to really feeling alive. And nobody in that conventional medical system, nobody was asking me about that. So basically, I've come to understand that, and I'm still understanding it, to be honest, that there's a true structural problem with how medicine works in the West. And that's despite how necessary and useful it is. And the way I see it, the problem comes down to this. The system is built to treat disease. It's not built to create health. And that's two very different things. There's a British physician and an author in the UK who's called Dr. Rangan Chatterjee. I hope I pronounced it well. He talks about this a lot, about how the current medical model is designed for acute crisis. Like you break something, we fix it. You get an infection, we treat it. And it's brilliant at that. But for anything else, for the chronic stuff, the stress stuff, my body is slowly giving up on me kind of thing, it falls short. Those things, they aren't fixed with a clear procedure. It's more about preventing them with a way of living. And the system, the medical system as it is, it doesn't have a protocol for that. And it feels to me like that's exactly what I experienced. I was in the system with a body that had been screaming for quite some time. I've talked about it before. And nobody asked me about my stress levels. Nobody asked me about my sleep. Nobody asked me about the burnout or the depression or the fact that I had been pushing myself past every signal that my body had been giving me for years. Instead, they looked at the hernia itself. They looked at the spine. They treated the localized problem. But the context, the whole life that led to that spine collapsing, that was irrelevant to them. And that's explained really, really well in The Body Keeps the Score. It's a book by Bessel van der Kolk. And basically he talks about how Western medicine tends to treat the body as separate from emotional and psychological experience. So like your back is one department and your stress is another department, and they don't interact with each other. But in reality, that's not how our body works. The body is one system. And when you're under chronic stress, when you're burnt out, when there's, psychological issues, stress level issues, and when you're carrying more than you can hold, it shows up physically as an actual diagnosable problem. And somehow it's not being connected back to that. So in the case of my hernia, if they had looked into it, it wasn't just a random hernia out of nowhere. It wasn't a one-off injury. It was more like the final straw, the final symptom on a long series of signals that I'd been ignoring for years, for months at least, if not for years. And I think this happens to so many women, and especially overthinking women. Sometimes it's minor, or like what we consider minor things, but it's not actually minor. Maybe the migraines that you can't explain, the migraines on repeat, or some gut issues that you keep having and somehow the doctors keep giving you medication for it, but without really asking you what you eat, how you sleep, how you're stressed about, what you're stressed about, or chronic pain in the body. So many people have chronic pains in the back, in the legs, whatever, and it just gets managed with prescriptions, painkillers, but never really actually looked into. And you just keep going back to the doctor and they keep treating the symptom. And the root cause is just being ignored and it just sits there. And the problem with that is that if you don't look into it for too long and if it stays untouched like that for too long, it can just grow until it gets into some more serious injuries or some more serious problems. There's really something about the pill culture that I want to talk about because I think it's part of the problem. And I'm not, again, anti-medication. There are absolutely a lot of situations where medication is necessary. It's very relieving. It's great and life-saving at times, obviously. But somehow, somewhere, we started defaulting to this idea that every problem has pharmaceutical answer. I was raised in the house because it was very much in the generation of our parents where most people were told that medication was kind of the answer to everything. Anytime we had a bit of pain, we would be given painkillers. Not that it's like extremely damageable or anything, but by default, it was kind of the answer to any type of pain. So in that culture, pain means painkillers. Inflammation means anti-inflammatories, and so on and so forth. But the question, the why is this happening in the first place, gets skipped. And it's kind of a vicious cycle because it's usually the reason why we don't ask those questions because it takes longer. It takes more time to just sit with that question and try to understand and try to monitor what we're doing to understand what's working, what's not working, and we're too busy for that. And the system itself isn't built for that. In the case of my hernia, what really was probably the most telling that way in my own experience was the infiltrations. They kept pushing infiltrations, most doctors. And I kept telling them, but I don't want to mask the pain because the pain is information. The pain is telling me something. It's telling me that something's wrong. And if you take the pain away, I'm just going to be back to doing what caused this. And let me tell you, they looked at me and they made me feel like I was being difficult. Like, we're offering you some sort of relief and you're saying no. You're the one being difficult. But that's not what I was looking for. I did not want relief. I wanted to understand. And I wanted some people, to help me figure out why my body was collapsing. Because the motive behind that is that I wanted to make sure that it wouldn't happen again. So that's probably really the part that kind of changed things for me, because after the acute phase, when the worst of it passed, I started looking into other options, into other things like osteopathy, movement work. And the idea was to look at my body as a whole system, not just as, an addition of parts that break independently. And the idea down the line is just to ask a different question. Instead of asking what's wrong with you, you ask questions like, what happened to you? Have you been stressed out lately? Or what does your body need to feel safe again? So when I started to see more alternative care practitioners, it felt like finally, for the first time, some people were talking to me, not just looking at the results of MRI of my spine or anything. They were talking to me, the whole person, with a set of habits, with a certain past, with a certain level of stress that they needed to understand. And that really changed a lot of things for me, and that really switched my entire perception, because now I was going from solely fixing, to understanding. And so you're not just treating the symptoms anymore, but it's more about focusing on the root cause of things. And in the grand scheme of things, if I think of my life overall, that's a very recent switch, a very recent realization for me. So I'm still definitely in it. I'm still in this realization process. My back still acts up. I literally just kind of injured my back again, and I'm still learning what my body needs. And I'm actually preparing another episode on that topic. It's going to be the next episode, but I'm still figuring out overall how to listen to my body. So I'm still very much in the process, but I know something now that I didn't know at the time, that I didn't know before. My body isn't a machine that's breaking. Instead, it's a whole system. And sometimes we just overload that system. So you can't fix that or repair that only in a mechanical way. It's relational. You have to rebuild the trust with your body, and you have to understand all the factors surrounding your injury to make sure that not only you fix the issue at stake, but you don't go through that injury again. So this is what I want to leave you with, or better said, I'd like to invite you to join me into this process, because I'm not just going to sit here saying that I've figured it all out. That's not true. But I'm definitely in the process of figuring some very important things out. So just sharing and telling you what I'm noticing along the way. But if you've been through something like this, whether it's a major injury, in the case of my severe hernia, or even if it's like a chronic pain or like things that you often see the doctor for and you don't really have the answers, or it doesn't feel like they're actually fixing the core of the problem, try to really think about the questions that you were asked during your recovery process, or in the case of like a non-injury, when you keep going to the doctor, what are the questions that they're asking you? Were the questions about getting you functional? In the worst case, getting you productive, getting you back to normal, quote unquote? Or were they about what you actually wanted? What you missed about when you didn't have that injury or when you didn't have that chronic problem? And that's going to tell you a lot about the type of recovery that you're going through. And if your answer to that question is that they only ask you the first type of question to get you back to being productive, to get you back to being functional, etc., and no one actually asks you the second type of question, try to ask yourself that question. What do you actually want from your body? So it's not what do you want your body to do for you, but it's what do you want your relationship with your body to feel like? What would it mean for you to trust your body again, to enjoy it again? And it's very important that you try to take distance and that you allow yourself to, appreciate what is being done. It's also important to have the diagnosis and to have some possible treatment with conventional medicine. And you're allowed to appreciate that and to also ask questions and to also, I'll just give you an example about the infiltrations. When I was asking doctors, why are you prescribing this to me? What else? I'm very open to an answer. What else other than masking the pain are infiltrations going to do for me? And I was really open to hear something like, actually it's going to help in that way, and it's going to help you recover faster. No one could answer me, and yet they kept pushing for me to have infiltration. So it's very important that you question things, that you have conversations with your doctor to really understand from what angle they're approaching your recovery. Are they understanding the whole system, or are they just trying to follow a protocol and fix that one issue that you have, knowing that it might not be what you need right now? And it's important to not feel like you're the one being difficult. Like when I was asking about those infiltrations and they made me feel like I was the annoying one in the conversation, at the end of the day, it's your body. So you're not being difficult. You just want a treatment, or like you just want a recovery that fits you and that fits your need in a specific moment. So for me, I touched on that already. The answer to those questions was that I wanted to dance. I wanted to surf. And I wanted to be able to be back to walking, like active walk, and feel my feet on the ground and not being just in my head, kind of thinking of the pain only and just feeling in pain after 5 minutes walking. And that's what getting better meant to me. That was my metric. That was my reference. Not productive. I couldn't care less about productive. I wanted to feel alive. And I'm sure you have your own version of that. I'm sure we all have our own version of that. Your own thing that has nothing to do with, being functional or getting back to work. The things that you actually want to go back to, and the way you actually want to feel in your own skin. And that's probably also a way to be very open with yourself and very transparent about what you like. Honestly, the sky is the limit. You could be discovering, asking those questions to yourself, that you want to do pole dance, that you always wanted to feel very sexy, but that you never dared doing it. The answer could be literally anything. And maybe it's time that you name it. Even if it's just to yourself, it doesn't need to be anything public. You don't need to tell anyone. It's just being very honest to yourself, because your body will hear it too.